There is no treatment for COVID-19, no early treatment, and no treatment for hospitalized patients. The only way to fight COVID and end this pandemic is for everyone to get vaccinated. Why is this correct? Even though there are a lot of scientific studies from different parts of the world, it has been stated repeatedly that they are poorly conducted, not enough, not conclusive, or simply that more studies are needed. And the thing is that most people, myself included, don't have the capacity nor the time to read and analyze all available information. In general, it's very difficult to know what's true. That's why we must rely on institutions that protect us from being deceived. When we say that a particular treatment shouldn't be used for COVID, or that the only way to fight it is through mass vaccination, we are trusting what the leaders and institutions tell us. The CDC, FDA, NIH, WHO all have the same expert opinion, and we trust them. That's the reason why we are confident in what we so strongly believe is the truth. But what would happen if those institutions blatantly lied to us? If that happens, the whole argument depicted above crumbles. We just wouldn't be able to be so confident of all the conclusions we established as true. And if knowing what the truth is can prove to be very difficult in many situations, noticing an obvious lie is sometimes very easy, like in the next examples. This one is from August 21st, 2021. Here, the FDA is suggesting that the drug in reference is for animals. They are emphatically saying that you shouldn't take it because you're not a horse nor a cow. Even the picture sends a strong message that you would be treated as a horse if prescribed the drug. Many people, as a result, do believe that that drug is just for animals and not for humans. The fact is, the FDA has approved that drug for humans decades ago, and it's been used in millions of humans since for treatment of various diseases with an astonishing safety record. So, there actually is a version of the drug with a high concentration that is specifically intended for animals. But also, there is a version with lower concentration that is approved and has been used in humans decades ago. The very same article in reference states that, as this title shows, there is a version for animals and a whole different version for people that has been approved and used for many years. So, suggesting that the drug is not for you because you're not a horse is a tremendous lie. Shouldn't we expect to receive true quality information from institutions as important as the FDA? We should be able to trust them completely. How can we? Second example, August 6th, 2021. A media statement from the CDC presents a new study. The title of the statement reads, "Vaccination offers higher protection than previous COVID-19 infection." The interpretation is very clear, right? If you compare people that has been vaccinated with people that has had COVID-19 and recovered, the ones vaccinated are more protected. Their immunity is better. That is what the title states. There actually is a debate among experts. Some say natural immunity, the immunity of a recovered COVID-19 patient, is better than that of the people vaccinated who haven't had previous infection. But if we go by the title of the CDC statement, those experts are wrong, aren't they? Well, again, by the title, it certainly seems so. Although, if we read the article they are referring to, we realize a whole different story. The study is about the risk of reinfection. It doesn't compare the two groups described above. It only includes people who already have natural immunity. Meaning, all people in the study have already had SARS-CoV-2 infection. The study compares two groups of people. One, people with previous SARS-CoV-2 infection who are not vaccinated, and two, people with previous SARS-CoV-2 infection who are vaccinated. So, the study states that vaccinating people who already had SARS-CoV-2 infection enhances the immunity they already have. In no way it can be proven by that study that people vaccinated and with no prior SARS-CoV-2 infection is more protected than people with prior infection and not vaccinated. The study doesn't even involve people with no prior SARS-CoV-2 infection. Again, why does the CDC lie to us? These are the institutions we are supposed to trust and upon which we base our conclusions. In a nutshell, most people don't have the capacity nor the time to read and analyze all available information. We say there is no treatment for COVID-19, no early treatment and no treatment for hospitalized patients, and that the only way to fight COVID and end this pandemic is for everyone to get vaccinated. But we haven't been able to read and analyze the existing scientific studies. Doing that properly is hard and requires a lot of time. So, when we say the above, we are just relying on and trusting what the big institutions tell us. What I just showed with a couple of examples, among many, is that these institutions are blatantly lying to us. And so, the base upon which we establish our conclusions is wrong. The argument is very simple. Therefore, we must look more deeply into the subject, stop attacking different points of view, and start demanding the governments, institutions, and media to be transparent and promote discussion among experts with various perspectives. That is the only way we can put an end to this pandemic.